My name is Julie Suyama. I am a urogynecologist and I help women with pelvic floor dysfunction. I like taking care of people in the way that we as humans are, as a whole being. So while women are coming in to discuss either pelvic organ prolapse or urinary incontinence or accidental bowel leakage, sexual dysfunction, many things that people often don't feel comfortable discussing right off the bat, I love that I get to elicit that from patients and find out what other things may be contributing in their life. My background is in neuropharmacology, and my research over the past few years has really focused on the brain-bladder connection and how our central neurochemistry and our behavior impacts our bladder function and vice versa, with the hopes that over the course of my career, I can roll out novel treatment strategies. I love giving people their life back. Something that drew me to urogynecology is it's really a quality of life specialty. My patients have such extremely morbid conditions that have a significant negative impact on their quality of life. Women stop interacting with their friend groups and their social circles, stop playing sports because they leak urine every time that they jump or move. So I really love what I do because I can restore women's pelvic floor function and get them back to the lives that they were living before, that they were happier and healthier and more active. They can expect a smile and a friendly face and an open ear. Really, I want patients to come in and feel comfortable being completely open and honest about what ails them so that we can offer our expertise. And I love treating patients in a variety of manners. We have various options for providing care for either prolapse or incontinence, conservative management, all the way up to surgical intervention. I love operating. I love our surgical staff and working with teams in the OR. And so I like meeting patients where they are, eliciting what their goals are and then helping them get there.